Module 3, NCLEX RN test format. The NCLEX RN exam is coordinated according to the framework Meeting Client Needs. In this NCLEX exam, there are practical questions, and this will consist 4 main category and 8 subcategory. They have other nursing exam also, but they all are about caring, mental, pediatric, this types. Sample question. A 23-year elderly person with insulin subordinate diabetes mellitus, IDDM, is gotten back to the recuperation room 1 hour later, a standard delivery of a 9 pound 8 ounces and child kid. The nurse would expect the lady's glucose to 1. Rise. 2. Fall. 3. Remain stationary. 4. Fluctuate. To choose the correct answer, you must consider the pathophysiology of diabetes alongside the principles of work and delivery. Taking the NCLEX RN CAT is an abbreviation for Adaptive Computer Test, an interactive testing design based on your reaction to the questions. Based on your ability level, the CAT guarantees that the questions are not too hard or too easy. Your first question will be generally easy, beneath the degree of minimum capability. Next, the PC chooses a slightly more complicated question if you answer it effectively. If answered incorrectly, the computer selects a little easier question. By doing this all through the test, the PC can determine your degree of ability. What kinds of questions are included on the NCLEX? According to Kelly Beischel, a licensed nurse and NCLEX success mentor, NCLEX questions are prepared at the application or more important levels of cognitive capacity to assess the candidate's puzzling thought processing. There are many decision, fill in the blank, issue area, different reaction, and ordered reaction items that can be used. You will get multiple answers for making the correct answer. Choosing the most right answer for the situation, on the other hand, can demonstrate that you'll think critically and make competent decisions as a nurse. RN Esfira Shakamurova explains, the NCLEX encourages you to think through every issue presented. It confuses the reader by presenting 4 or 5 scenarios, but as a nurse, you need to prioritize your work and work within your limitation. Some inquiries throw you off, but you're simply prepared to respond to the inquiry. Shakamurova proposes that you break down each question to understand what is being requested and how you should accommodate the patient first. Other NCLEX questions demand the same vital memory and knowledge of reality as any other test, so you'll need to commit a large amount of time to learning and memorizing important nursing concepts. Questions are primarily different decisions with 4 possible answers. However, there are other question forms as well. Multiple response, fill in the blank, problem areas, diagram, dotted exhibit, and intuitive questions are examples of alternative question kinds. All of the questions include nursing content that has been integrated.